We are happy we have doctors and surgery and medical intervention, but at the same time, medical equipment can create deviations in your child's milestones or movements. Hi guys, it's Michelle from Movement Lesson. Medical equipment can create deviations in your child's milestones or movements. Especially what's really common is that when a baby is first born, let's say, the vein is actually a bit better than going in through the ankles than it is through the hands. Lots of times later that you see with cerebral palsy, let's say, a much narrower foot. That can be from the pulse oximeter or from the IVs that were there. But an IV to the foot, even though they're about 3 to 6 ounces of weight, can create issues within the countering of the pelvis and even for the vision countering. The first month of life is the foundations for all their movement, and when a movement is prevented, not only will a baby not try to overdo it or supersede the movement, but they will actually try a different way of doing the movement. And that's where you start getting deviations in milestones development. With cerebral palsy, you have much more medical intervention, typically. If your child has had birth trauma at any point, whether you're doing movement lesson or some other modality, you really want to initiate movement through the feet. And you can see the difference here when I work with different ways of your child's feet. Usually with cerebral palsy, it's a much longer hospitalization. Not in all cases, but much longer. So pulse oximeters can, in a sense, almost like a Chinese foot binding. If this isn't opened up after you're done with the meter, and sometimes this goes on for months, line IVs into the ankle and they wrap it, and even later on with AFOs or splints to do that. You lose a lot of movement and circulation. Kids with CP have much colder feet in general because of the lack of circulation in this. So the foot tends to curl or to narrow because it doesn't feel standing in the foot. Using the theraballs and movement lesson is one of the ways that I can get in there using the rotational movements that I teach and getting a lot of these small bones in the arch of the foot to start moving again. There's many different ways of working with the hands and the feet. Obviously, this is just one of them, but it really helps with the weight transfer, counterbalance, and rotational movements that are needed for foot function for everybody. Kids with cerebral palsy, it's not that they can't do something, they usually just don't get the exposure to movement, especially early on in their development, and that's really when you want to offer as much as possible.